Visits. This is a podcast that is trying to make healthcare decisions a little bit easier for Seattle area families to navigate. We want to make things smarter and easier for you guys. I'm Dr. Sean Park. My practice is Lighthouse Pediatrics in Issaquah.
And I'm Dr. Judy Hsu. My practice is Myrostar Health in Bellevue, Washington.
Welcome, everyone. So today we're going to talk about two things. We want to talk about some of the vaccine preventable illnesses that are going around our area and the country right now, and then also some healthcare savings tips, ways to spend your healthcare money maybe a little more smartly.
That's right. I think this is a topic that I think a lot of people will find helpful, especially when healthcare costs are going up and up. And, sometimes people just need to learn a couple of tricks and tips to help them save some money.
Yeah, it's crazy. And coming from inside as a professional, a healthcare professional, it's a little bit easier for us to understand, but still not that easy.
Yeah.
So let's start off with the vaccine preventable illnesses. The measles outbreak is the big headline grabber this year. It started in Texas, it spread across the country, but even though we're hearing less of it these days, the hotspots right now are in Arizona and Utah, and there have been about almost 1,800 cases as of a week ago.
Yeah, we did a talk a couple months ago about this, and I think around that time, I think it was early this year, it was all concentrated in Texas. But now if you look at the map, it has affected multiple states. So this is no longer a Texas problem or a New Mexico problem. We're seeing cases everywhere now.
That's right. Yeah, even here in King County, there was one case last week of a gentleman coming through the airport.
A King County resident is now the latest person in the state to contract measles, prompting an exposure investigation by public health officials.
Yeah.
It just happens.
Yeah, and that's really concerning because we know measles is very contagious, right? The virus itself can linger in the air for up to 2 hours. And 90% of the time, if you're not vaccinated, you're more likely to get the infection. So this is why it's kind of scary to think about how wide it has spread just because of how contagious it is.
Absolutely. It's so contagious, and it's not an easy illness to live through. Most people do, but the rates of some complications the severity of some of these complications are really high, even though they might be uncommon.
Right. You mentioned in our talk a couple months ago, there's a specific case you saw while you were doing your training.
Yeah. So, the complication is subacute sclerosing panencephalitis.
That's right.
So this is it's an uncommon complication of measles. It happens in about 1 in 10,000 kids, but it's devastating. It's a deadly complication. Kids do die from this, and they die years after having the infection. So it's not even something that we think about when we first see a kid with some serious illness, serious symptoms, but it happens years later, which is scary.
Yeah, that is a very, very scary thought. I think that's the thing with a lot of these infections itself. Sometimes you might run a pretty mild course, but it's really the consequences of having this infection that also worries the providers as well.
Right. Yeah. I mean, measles itself, the illness, you might get high fevers. Kids are very uncomfortable. It's not fun. It's not just a random cold that they get.
Yeah.
And then they get this rash. And then usually they're okay in a couple of weeks, but it's these complications that we worry the most about. And that's not even the only one. There's something called immunity amnesia that we'll see with measles too. You can get it, and then you lose all the immunity that you've built up to common cold viruses, bacteria that can cause pneumonia, other things like that.
Wow. So even to other viruses, you lose the immunity. Yeah. That is not fun at all. Yeah. And it's also kind of hard to diagnose, right? Because I think it can mimic so many other respiratory illnesses, and we are dead in the middle of the season where we get all these respiratory viruses that just circulating around the community. So the symptoms can start out like fever, body aches, headaches, sore throat, right? Very, very similar to sort of any other viruses that we usually encounter in the colder months. So that's why, when you have symptoms, you do want to go to the doctors and maybe even get tested for it, especially if you live in an area where we know there have been confirmed cases. And especially if you haven't been vaccinated or you question whether or not you still have immunity, because we know that measles immunity can also wane over time as well.
Yeah. It's a challenge too, because this, our generation, even maybe the generation before us, became physicians in an era where we didn't see a lot of measles. So we have to really think about it, and it might not be the first 2 or 3 things we think about when we first see your child or an adult with fever and rash.
Yeah.
And that's the other problem here too, is that this was an illness that was almost eradicated in the United States. Like we were getting as few as 100, maybe 1,000 cases a year.
Yeah.
And at a certain point, we thought we were done with it. And then because rates of vaccines have gotten so low, that's the reason why we're in these outbreaks right now.
Yeah, I read that we are on track to lose our elimination status by next year if the rate of infection continues to stay where it's at, which kind of sucks because, for many, many decades, we were not in this place at all.
Yeah,
so
that's an unfortunate complication of this.
Yeah.
Another illness that's on the rise recently now is whooping cough. So whooping cough is another illness that affects infants. Older kids and adults can get it too, but we might not even realize that we'll get it. But when an infant gets it, especially an infant under 2 or 3 months, it's an ordeal. It's a month, maybe 2 months of symptoms, and oftentimes kids are hospitalized with it.
Yeah, I think people forget that, like, back in the early 1900s, like, pertussis or whooping cough was one of the leading childhood deaths, right? It's not until like we start vaccinating kids regularly that we started to see less and less complication from this disease.
Right.
And you're right, it is scary because I've seen cases in the hospital when I was doing my training where, infants that get super sick because, at the time when their respiratory muscles are not strong enough, and then now they have this really awful infection where they're really struggling to breathe. Because what this infection does is it basically forces your body to produce really thick mucus, and then so your airway's plugged up. And so as you can see, like for infants who don't really have really all the respiratory muscles strong enough to be able to like cough and get rid of the mucus, it can turn into a very severe respiratory complication.
Right, absolutely. And one thing that I think contributes maybe to why, as a society, we don't take it as seriously, is that this is different from croup. And that's something that I think some parents get confused. They think, oh, my kid had croup and he got over it, or we're immune to croup, so my baby, we don't have to worry about it. But croup and whooping cough are really separate things. And, croup is a virus. Most kids do get better from it. Sometimes they need help. Whooping cough is entirely separate. So an infant who has whooping cough, they'll cough, 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 and then they'll whoop. And then that breathing pattern is what makes it really hard for them to just breathe. And that's why those kids need to be hospitalized for it. Whereas with croup, you might need to be in the ER. You get over it within a day or two most of the time.
Yeah. Even for adult, the coughing fit could be quite severe to the point where you could fracture a rib or two. That's been demonstrated or documented before. So, I definitely have seen cases of pertussis in adults where their ribs get sore, their diaphragm gets sore, and they often just become very tired from all the coughing that they're doing.
That doesn't sound funny.
No, but the good news is we have vaccine for it.
That's
right?
Yeah.
You can get it as young as 2 months and all the way into adulthood. We're still vaccinating people with boosters every 10 years as part of this package with tetanus and diphtheria. And even like pregnant women are definitely encouraged to get it. Usually pregnant women get it when they're around 27 to 34 weeks of gestation. Very important, so then the mom can then pass the antibodies down to the infant so that by the time the infant's born, the infant has some immunity.
Very, very important, because until 2 months, they only have the passive immunity that mothers might have. And it's a relatively recent recommendation, correct me if I'm wrong, if that pregnant women get this with every pregnancy.
That's correct.
So
yes.
So that's the idea. So pregnant women are hopefully following this recommendation so that they can pass these antibodies on, because the babies don't get their first vaccine until 2 months, which means those first 2 months, it's only the antibodies that came through the placenta.
Yeah, that reminds me also of this concept of cocooning, of vaccinating those who are going to be in close contact with the infant. So that could be grandparents, it could be siblings, it could be neighbors, whoever is going to be in close contact with the infant for like regularly for a period of time after birth, to get these people vaccinated. but you have to make sure that you get vaccinated early enough so that the person actually develop enough immunity and antibodies to be able to like have that cocooning effect.
Absolutely, yeah. It's an important benefit. I think of it as an indirect benefit to kids to protect them, and I really never say it's enough. When parents say, well, everybody's vaccinated and we're going to try to stay at home, it's as a maybe reason not to vaccinate their children. I always, the only thing I say to in those situations is that we never know how kids get it, and most of the time they are in those kind of cocoons, and which, like I said, helps, but kids still get sick with them.
And as a strategy, it's actually kind of hard to implement, right? If you think about, especially if you're from a big family, getting everybody all lined up so that they're all vaccinated can be hard to coordinate. Right. So even though scientifically that's the recommendation, it is helpful, but logistically, realistically, that's actually really hard to coordinate.
And it's not like you're checking vaccine records and making sure everybody's up to date.
Right. That can make some pretty awkward conversations.
not one to have at the Thanksgiving dinner table.
Yeah. So I think the good news is we have vaccines for it. Like the reason why we keep giving people boosters also because in the 1990s, actually, we changed formulation from cellular pertussis to acellular. So that means immunity tend not to stick around longer as we would want it to be. So that's why it's important to make sure that you are up to date and getting your boosters. And that's why it's also important for pregnant women to get the shot like with every pregnancy.
Very important, yeah. One thing to keep in mind too about, both of these illnesses, measles and pertussis, is that we really don't have effective treatment for it after you get the illness. Measles, it's a virus. We have to let it run its course.
That's right.
Whooping cough, we do have an antibiotic, but it's more, the effect has more to do with preventing the spread and maybe shortening the course, but it doesn't get rid of it the way like antibiotics might for pneumonia.
Do you do post-exposure prophylaxis for pertussis in your practice?
We do, for the child and for the family members.
Yeah. And remember, the antibiotic that we use actually is a pretty common one that we give. So, over time, if enough people get it again and again, we might run into issue with antibiotic resistance. And that's not a good situation either, because I think there are already reports in China where they're seeing that some pertussis cases that were not really, responsive to the typical antibiotic that we give.
That's right. So, that's why prevention is always the better choice if we had to make it.
Absolutely.
Right.
Yeah. Practical tips to help you save money. Who doesn't want that?
It's tough. Like
healthcare is just getting more and more expensive, right? As with a lot of things, but with healthcare, it's like every year, you're seeing the premium goes up. Especially, I think, with next year in 2026, with the credit expiring for the ACA, that a lot of people are seeing at least a 20, if not 30% bump in their healthcare premium,
right,
which may mean that some people might have to forgo insurance coverage altogether. And people still will get sick. So how do we navigate that environment where some people are not insured and still need to get care? So this is where I think we can really kind of help share some tips with folks to help them maybe figure out, okay, even if you're uninsured or if you're underinsured, like what are some of the ways to save money on healthcare expenses? It's
a challenge, not just in the expense, but the uncertainty too. And that's one thing I like to start with is just the understanding a few ways that the expenses can balloon and you're not even aware of it. So one of those things is a facility fee. If you ever go to a hospital-based system or just a larger system, one thing to watch out for on your bill are facility fees. So if you go just to get an X-ray or a lab and that's it, you might see on your bill that you had to pay $50, $100, maybe $200 just to the facility for getting that procedure done. And that's something that sometimes gets folded into your insurance payment, and sometimes not. Sometimes that's out of pocket. And that's always something to consider. And that's one. So the tip for that is look for or ask for independent practices, independent labs, or X-ray, imaging centers, for example, to avoid those kinds of fees.
So like basically those locations that are not attached to a bigger hospital system, right? So that would be like Swedish or UW or Virginia Mason. These are all attached to bigger hospital system, which may translate to higher facility fees, unfortunately.
Yeah, and if you can't avoid them, and sometimes we can't, then it's something to ask about. If you're asking about the cost and you're trying to do some shopping around for the best price out of pocket, sometimes that's a good question to ask.
Absolutely, yeah.
And that kind of leads us into our second tip, which is CPT codes. So what these are is a way to, so what these are codes that are attached to every procedure, test, lab, something a provider might do.
Something to make healthcare more confusing, basically.
Yeah, right, exactly. There are books this thick that tell all that list all the codes and everything.
Yeah. I always joke with patients, you need a PhD probably to like be able to understand like all the different lingos and codes that we use in healthcare. I'm still learning for sure, even though I've been in practice for over a decade.
Right. Just for this billing part of it.
Yep.
And what this code does is it allows you to get apples to apples comparisons between two different providers. And this is what you need. So even though your doctor might send you for an X-ray, there are hundreds of different kinds of X-rays, what to shoot, how in the direction to shoot the X-ray in. And what this code will do is the same code will be the same X-ray at two different places. And then you can take that code to both imaging centers say what will it cost and how much will my insurance pay for it. So what is my out-of-pocket cost going to be? And that's really the only way to do it. So the way to get this is to ask the ordering provider, so usually one of us, like a primary care physician or just a provider that's sending you for this test, ask them for the CPT code. And sometimes you might have to ask their biller because the provider might not know. But once you have it, then you can shop around.
Yeah, usually when you call into a billing department, that is also one of the questions they will ask you. If you have any question about a particular charge on your bill, they will ask you for the CPT code, and that's what it is. Like, so it's good before you call in to be prepared and just know what they are. So when they ask for it, you can just provide that.
And that leads us into a good tip of yours, which is how to ask for billing, how to ask for the billing from the provider.
Yeah, so like once you know the test you want to do and the CPT code, sometimes it's actually cheaper to pay for services out of pocket versus going through insurance, because a lot of hospital systems will actually give you a discount, and a pretty steep one at that. I have encountered upward of 50 to 60% discount if you choose to pay out of pocket upfront. So especially if you have like a high deductible plan and you have a major deductible, you have to pay for that service or that imaging or test entirely out of pocket. This may be a really good option, is to call ahead and say, hey, I'm going to pay out of pocket instead of going through insurance. Like, what would be the cost of this service? And to also remember to ask for like any payment plan, sometimes hospital system will also give you payment plan, knowing that, some of the tests that you do may be a pretty substantial chunk of money. So they will usually work with you to figure out what is the best way to pay for that service. So that's like one thing to always check out.
Right. And on top of that too, it's always helpful to ask for an itemized bill. That way, especially if you have, this is more for when you're doing more than just a single test at the facility. If you're ever hospitalized or end up in an urgent care or ER, if you ask for an itemized bill, they'll break down all of the things that were done or given to you over the course of that visit. And sometimes just by looking at that bill, you can see mistakes that were made or things that were coded differently or
things that were duplicated, or if there are items where you're like not even sure what they are, you should ask, because maybe they shouldn't be there in the first place, right? So always make sure you understand what each item means.
Right. And you can always ask. That's the point of asking for an itemized bill, is you can ask for what every one of those means, and the provider needs to be able to answer that question for you. Needs to be able to tell you everything that was on that bill.
That's right.
And sometimes just by asking, beyond the cash pay discount, beyond the shopping around, beyond the itemized bill, just asking for a discount.
Yeah.
You can get one.
Yeah.
Sometimes.
If you don't ask, you won't know, right? It doesn't hurt. The worst thing that they could say is no, right? So always ask.
Right. I think another good tip is to hopefully go to the place that will treat you at the level that you need to be treated. So if you don't need to go to an emergency room, go to an urgent care. And if you don't need to go to an urgent care, go to your primary care physician first.
Yeah, that's right. I think the best practice is probably to always check in with your primary care first, because your primary care, probably based on your symptoms, will be able to help you triage and figure out what would be the most appropriate facility to go to. Maybe that's even something that primary care can take care of, and you're just not aware that they have the capacity or the capability to do that. So in my practice, for example, if people suspect like urinary tract infection, like don't go to urgent care. Like I can just test your urine and maybe treat you on the same day, right? Or if you come in with a sore throat, maybe you don't need to go to emergency room because your vitals are still stable and you're not struggling to breathe, right? So it's always probably best practice to just check in with your primary care first to help you navigate and figure out what would be the best facility to go to.
Right.
Yeah.
And hopefully you have the relationship with your primary care physician that you can get an answer for that fairly quickly when you need it. I
feel like this is where DPC, direct primary care, really shines, is that you have that relationship with your doctor. You can get a hold of your doctor really quickly. Like my patient can get a hold of me on the same day and we can kind of talk things out, or like text, send photos if it's a rash, etc. So this is kind of where I think direct primary care really can be helpful in these kind of situations where you're just not quite sure how to utilize the healthcare system based on your symptoms.
It's hard because we don't know. I mean, I can understand why families and parents and patients just don't know where to go. You know, they don't know what's going on. They don't know how serious it is. That's why they come to us.
Or they will Google a symptom and then 20 to 30 different potentially life-threatening conditions will show up, and you're just like, I better go to an emergency room.
Right.
Right. When in fact, maybe if you were to go to your primary care, he or she can help you navigate and okay, it's probably not life-threatening because of XYZ.
Right.
So this is why, Google is good for some things, but, in a pinch might not be the best tool to help you figure out how do you seek care and where.
Right. That's why I really like what you said about direct primary care practices. That's one of the reasons I got into it. I imagine it's one of the reasons you got into it, is that we can be helpful in those situations where it's harder for traditional insurance-based providers to be that available.
Right. And, ChatGPT and Google are not going to really know your medical history. So a lot of times symptoms have to be looked at in the context of your medical history and as a whole person. So you're not going to be able to get that level of individualized answer from just looking up things online.
Right. Absolutely. Yeah. That's the big thing.
And emergency room physicians are going to thank you. Let's not forget that. They also don't like it when people go in for a sniffle or a sore throat. I have heard emergency room doctors complaining to me about how people these days are using emergency room like their primary care doctor, which is the wrong thing to do. You don't want to do that. But unfortunately, a lot of people don't have that good relationship with their primary care doctor, or it's hard to get into their primary care doctor's schedule for a visit, or even just to get someone on the phone, right? So just remember, you're also, doing the emergency room physicians a favor by staying out of there when you don't need to be there. Obviously, if you need to be there, you should be there.
Yeah.
But let's make sure that we triage it properly and that you go to the right facility. And it's going to save you money as well.
Absolutely. And if we can help with that, that's what we want to do.
That's right. Yeah.
Now, as far as prescription medications, prescription drugs, what kinds of tips do you give to your patients?
Yeah, that's a good question. So I would say in general, if you are on a medication that you're taking every day, that you'll be taking it for the year and for many years to come, it's probably best to try to get a 90-day supply versus a 30-day supply, because usually insurance will give you a slight discount when you fill a longer prescription, or even try doing mail order. Sometimes doing mail order could be cheaper than going to an actual pharmacy, so also check out the price differences there as well. I also love to use GoodRx. I always direct my patient to go to GoodRx, especially for medications that are not covered by insurance or only partially covered because it's a tier 3 drugs. They can go on GoodRx and look at the discount that GoodRx can give them by printing out that coupon and just taking it to the pharmacy.
Right. Yeah, it's an important tip. Sometimes actually not going through insurance and using something like GoodRx or another prescription drug saving program saves you money out of pocket.
Yeah, I think that's kind of the moral of the story here, isn't it? That sometimes it's not always best to go through insurance. You actually end up paying less when you don't go through insurance, which is mind-boggling for a lot of people, but it's unfortunately, not a lot of people know about this. And sometimes it just pays to shop around and just figure out different options.
Just shows how crazy the insurance world is, where you want to avoid it, insurance wants you to avoid it, and you actually end up saving money doing it.
Yeah. Yeah. I mean, it sort of makes sense that insurance company would, price it that way because they also have staff and employees to pay. So the more complicated the system, the more hoops you have to jump through, the more money needs to be siphoned out of that process, right? So, but you as the customer end up paying more because somebody's got to pay those employees to process all these claims.
Right, absolutely.
So, yeah.
As far as non-prescription medications, one tip I always say is always look for the generic version, the store brand version. It's almost always right next to the brand name. So Tylenol versus acetaminophen, for example, and you can usually save 50, 75% sometimes. Just right off the bat, it's almost always the same medication. If there's ever an exception and using the brand name is more important, we can help with that. But you'll be safe generally just going for the generic version.
That's right. They're usually the same. Maybe the bottle doesn't look as nice, but really the active ingredient is the same.
And sometimes they come from the same factories.
That's true. Yeah.
Just brand them differently.
Yeah, that's true.
Another kind of back-end saving strategy is using HSA accounts, if that's an option for you.
Yeah, so health savings account is actually a great way to help you save taxes because you get to put money in, pre-tax dollars in, and that money gets to grow in your HSA account tax-free. And when you take it out, any money you take out to use to spend on any healthcare related expenses is also tax exempt as well. So this is what we sort of call like the triple tax advantage of HSAs. So in general, if you have a choice to choose a plan that does offer HSA, go for it because that can actually end up saving you a lot of money as well.
And it's more convenient than I thought it would be. When you have this set up, usually through your employer, you get your debit card, and then you can use that for doctor's expenses, hospital expenses, but also over-the-counter medications, anything health-related you can use it for.
Yeah. And now even for direct primary care membership as well. And just remember, HSA is not the same as FSA. FSA is, oh my God. Flexible savings account. Okay, thank you. HSA is health savings account.
Yeah.
And that's the one that you want to go for that has the triple tax advantage.
I got it. Okay. Yeah. And then the last tip that we always mention is that prevention is the best cure.
That's right.
Yeah. If we can save you getting sick in the first place, if we can prevent you from getting sicker with a complication in the first place, and if we can take care of everything in the primary care office level, you're saving a boatload of money.
Yeah. I mean, just going back to our discussion on vaccine, right? It's probably cheaper to get a vaccine versus ending up getting sick and severe enough to need to go to the hospital with a giant bill, right? We all know how costly it is to spend time in the hospital, whether it's an overnight stay or a week stay. In general, that's going to be way more expensive than just getting a vaccine, right?
Absolutely. Yeah.
So definitely prevention is key here.
One of the main benefits of vaccines is it is far and away the most cost-effective when we're talking about just the financial cost, the most cost-effective medical intervention that we have. Vaccines are key.
Yeah. And we want to recognize that there are side effects to vaccines, but really your chances of getting the infection itself is going to be way higher than getting the side effects. So, in general, again, really has been studied and researched as a very, very effective public health tool and, also saves you money. If you really sort of go back to my example of getting sick and landing yourself in the hospital, that's going to be way more expensive than just preventing a severe disease altogether.
Absolutely.
Yeah.
It's important with vaccines and savings.
Yep.
So both of these elements are about proactive care. It's taking the steps that make life easier down the road. And that's what we're trying to do in this podcast, just make healthcare a little bit easier and smarter for Seattle area families and the internet.
Yeah. If you guys have any kind of topic suggestions, please feel free to drop it in and reach out to us. Again, we both have our own practices. Dr. Sean's is in Issaquah, mine's in Bellevue. If you want to join our practices as members, feel free to reach out. We can do like a meet and greet just to kind of get to know each other a little bit better. But yeah, I think the reason why we're doing this podcast is we want to be helpful. We want to inform the communities that we serve about the latest healthcare news and just, practical tips like what we just went over about how to save money.
Perfect. I think that was a great podcast. We'll see you guys next time. Again, I'm Sean Park with Lighthouse Pediatrics in Issaquah.
And I'm Dr. Chu with Myrostar Health.
Thanks, guys.
Thanks, guys. See you guys later.